Welcome to CBEST, to the School of Architecture and Planning. As you know, we are gathering tonight to celebrate our third symposium, which is entitled Health and Urban Vacancy in Baltimore. And as most of you know, this is the third one. We usually have an annual meeting in every April, and a fall lecture series between August and December. So I would like to acknowledge some colleagues and friends without whom we could not get together. First of all, the AIA Baltimore, which is our co-sponsor for this event, and Kathleen Lane, the president of AIA Baltimore. She has been an amazing source of help. Nathan Dennis, and the co-chairs of the Health and Wellness Committee, Heather and David, where are you? Yes, who have been a great source of help again, and support. I also need to acknowledge our sponsor, ZGF Architects, and we have two representatives from ZGF Architects. Without their generosity, we could not have the reception, this reception here. I need to mention that holding or organizing this symposium could not be possible without the help of many colleagues that I have here. First of all, Dean Akers, who has been very, very supportive of our Design Health initiative, and she is sitting back there. And my wonderful friend, Jeremy Cargan, the director of the architecture program, the graduate program, and Evan and Terence. And Terence should be behind the scenes. He's always behind the scenes. I must also acknowledge our student volunteers, Colleen, who is the president of our Design Health Club, and she's standing there. She's extremely hardworking and she has done a very good job leading our student Design Health Club. Thabang, Jinikachi, Alexander, David, who are all members of SRC, Student Research Club. I must also mention that as some of you know, we do have, for the first time, we are offering a Design Health studio, and students' projects are all pinned up there, and the topic of the project is the design of a wellness center in Pigtown, Baltimore. And I hope that after we are done, you get this opportunity to just walk over, take a look at the projects, and hopefully provide some feedback. Last but not the least, I must acknowledge my friends and colleagues in the School of Public Health and Ascend, Farin and Payam, who should be here, and Gillian, who have been very supportive of everything that we do here in the School of Architecture and Planning. So in terms of the presentations, as you know, we are going to have some charrette-like presentations. Each presentation is going to be just 10 minutes, very focused. And then after that, we are going to have a 1-hour roundtable. And hopefully, if we get the chance, we will open the floor to your questions and discussions. And one last thing, as you may know, we have the AIA Design Health Showcase boards here. And again, before leaving the building, I hope you get a chance to take a look at these projects, which were already presented a few months ago as part of AIA Design Health Showcase. So our first speaker is Eli Pousson, who is the Director of Preservation and Outreach at Baltimore Heritage, where his work includes the Explore Baltimore Heritage website and app, ongoing research on Baltimore civil rights heritage, and participation in the preservation review process for Project Core. Prior to joining Baltimore Heritage, Eli worked for the DC Office of Historic Preservation and completed graduate work in applied anthropology and historic preservation at the University of Maryland, College Park.
Well, thank you all very much for having me out this evening. I see a few familiar faces, but a few folks meeting for the first time tonight. So I'm going to be diving into this topic that I've been researching and talking to folks about for a couple of years now. And since we've been sharing this material for a while, we have a hashtag, actually, Vacants101. And so if you can't see the slides too well, you can go on Twitter and search for Vacants101, and you'll find the link to these Google slides right there, along with a whole bunch of other stuff. So just to kick things off, I always like it when it's not just me talking, but you all can participate too. So let's have a quick show of hands. How long has Baltimore had a problem with vacant houses? Raise your hand real quick if you think it's at least 25 years. Okay, keep them up if you think it's at least 50 years. So keep them up if you think it's at least 75 years. If you're going down, how about at least 100 years? 125? So, well, there's a few folks who are like, obviously, this historian has a trick. He's going to tell us that, oh, this has a really long history. Well, I hate to disappoint, but that is exactly what I am about to tell you. And so, of course, the reason that we're interested in the history of the vacant houses, the reason I really appreciate the opportunity to share this as the first talk to consider this evening, is that if we have any hope of understanding the solutions to vacant housing and their relationship to community health or individual health, we might want to understand how they came to exist. What public policies sort of helped create the existing condition of the city as it is. And usually, unfortunately, I think, the story of the history of vacant houses goes something like this. After World War II, we began losing industrial jobs, and then we just began losing so many people. They were moving all the way out. 1950, we peaked in population, had these great glory days back in the mid-20th century, and then it's just been a downhill slide ever since. And of course, this is a story that's laden with values and sort of a certain way of conceiving of the city. But most of all, this narrative of vacancy absolves anyone of responsibility. This is one that says it's just natural, folks. It's just old cities getting old buildings going vacant and falling down. This doesn't really help us understand a whole lot. It doesn't help us understand things like 900 North Payson Street. Is anyone familiar with this building? So folks who may be familiar is back in, I believe it was 2015, I forgot to bring my notes up with me, when the building on the end there fell down, crushed a man who was parked in his Cadillac right next to the building, a car that he loved. He lived on the block. We're at a point in Baltimore City where vacant houses kill people, and they've been killing people for a long time. And I think that one reason that we like to tear them down is because it helps us to exercise these sort of ghosts of deep racial and spatial inequality that these are such an iconic symbol of. And of course, if we dig into the history of this building, it tells us a whole lot more just than vacant buildings are so decrepit that they're falling down. It tells us that in 1973, this building was purchased by Baltimore City in a tax sale. Tax sales and the tax auction process, of course, being a huge driver of abandonment, of disinvestment, and of the city's growing stock of city-owned, publicly owned vacant houses to be responsible for. A case where a landlord milked this property for as much as it's worth and then was left the city, the taxpayers, the increasingly African-American population of Baltimore City at the time, holding the bag. So if we dig past this kind of convenient narrative of a post-World War II decline and begin to think a little more critically about why we have so many vacant houses, one thing begins to stand out. And this is certainly a story that many people know, how Baltimore City sprawled out into the broader suburban region. But what we need to understand is that the sort of metropolitan growth, this sprawl and subsequent annexation, the perhaps sometimes oversupply of housing in relationship to demand for residents related to like broader economic activities, this has been going on a long while too. So As the city has grown up from the early 20th century, we have increasingly designed around this sort of metropolitan scale, creating transportation infrastructure such as I-83 beginning as early as the late 1940s, early 1950s, building I-695 between 1955s, I think, when the first sections of that were opening, at a time where, you'll hear me hit this theme again and again, a disproportionate share of people who had access to an automobile were white and wealthy, while we were pouring millions, if not billions of dollars into the construction of infrastructure that was predicated on ownership of a private automobile, while simultaneously dismantling the public transportation systems that were the foundational basis for the development of these neighborhoods. And if you look at those numbers that we just looked at a moment ago, in this bigger context, you see that the Baltimore region has grown continuously since 1950, with more people spreading out across a larger and larger area. And so as we have more and more vacant buildings to deal with, of course, there becomes this new puzzle. What do we do with them? We count them, we police them, we tax them, eventually we tear them down. One thing that this, of course, has created, for whether it's Vacants to Value or Project Core, is the constant puzzle of how do we even know what this problem looks like. So CPHA in 1965, some of their advocacy around this is saying no one person knows how many vacant houses are owned by the city and how many should be raised, how many have a known owner, how many are needed for other uses, and how many are involved in some stage of the law enforcement process. A bit of a side note that the law enforcement process around housing in general began in the health department because housing was seen as a public health issue. You can see, too, the early interventions that were explored here. A 1961 aerial view from a Greater Baltimore Committee publication promoting the modernization of the code enforcement regime within Baltimore City, but of course did not, the modernization of that code enforcement regime did not eliminate vacant houses even from the featured footprint that they put on their very own brochure. And even in the present moment, we can't agree on how many vacant houses we have. Although you get the 16,000 vacant houses numbers thrown around quite a bit, that's, to be very specific, vacant building notices issued by the Code Enforcement Department of the Baltimore City Department of Housing and Code Enforcement. And if you look at the U.S. Census data, which counts dwelling units, you actually end up with a number that's much, much larger. The Baltimore Neighborhood Indicators Alliance tried to reconcile these two numbers in an analysis that found that the city has maybe closer to 30,000 or 32,000 vacant buildings instead of the 16,000 that we normally talk about. And of course, as I'm sort of like trying to bring it in for a landing within the 10 minutes here, the theme that I have been hitting all along here is, of course, the fundamental role of racism, segregation, and inequity in creating the conditions that allow for the abandonment or even encourage the abandonment of buildings within Baltimore City. You can trace the sort of stigma associated with vacant buildings all the way back to the debates around the 1910 Poe Law, one of the nation's first municipal ordinances to require housing segregation, in a language that sort of mirrors the way we still talk about vacant buildings today, in this case talking more about untenanted buildings that were, from the point of view of the letter writer, at risk of being tenanted or purchased by a black household. They say there are several vacant houses in the block, and this fear may be the potent cause of non-rental or sale. Each vacant house is a standing menace to the rest. And of course, the story then becomes a little more familiar with the Homeowner Loan Corporation's infamous redlining maps. The consequence of this, though, is not just that households were not able to get access to mortgages, but that black households were subject to predatory lending practices, contract buying, and a variety of other really exploitative real estate practices that encouraged further deferred maintenance and deterioration in many majority black neighborhoods in Baltimore City. To the point where it's something that I don't think gets talked about enough, but if you look at the data in 2013, neighborhoods that have less than half black residents, and this is going from the Baltimore Neighborhood Indicators Alliance data, have an average vacancy rate of about 2.5%. Where neighborhoods that have more than 80% of the residents are black, the average vacancy rate is over 13%. So what is Baltimore doing about vacant houses today? And of course, these concepts too have a history that I think we'll be diving into over the next couple presentations. But I think the choice is often boiled down to tear it down or fix it up. focusing on the building rather than this broader structural framework in which those buildings have come to exist. We sort of tear these buildings down. They make excellent press conferences and photo ops and are rightly celebrated by residents whose health is put in jeopardy by the persistence of these large hunks of unstable brick and poisonous paint and all kinds of other things that are bad about vacant houses. You have our governor, Larry Hogan, tearing down these on Stockton Street for the new development of Stockton Park. Of course, funding for that park is not yet guaranteed. So, and of course, these buildings, as they disappear, as we see here on Hoffman Street being deconstructed by Details Deconstruction, there's one waiting right behind for, because this work is far from done, and I think demolition or deconstruction alone probably won't get us there. So thank you for the time, and I look forward to the other presentations.
Thank you, Eli. Our second speaker is Dr. Joshua Sharfstein, who is the Vice Dean for Public Health Practice and Community Engagement at the Johns Hopkins Bloomberg School of Public Health. Dr. Sharfstein oversees the Office of Public Health Practice and Training, the General Preventive Medicine Residency, and major practice activities, including collaboration with public health agencies. Previously, he served as the Secretary of the Maryland Department of Health and Mental Hygiene, the Principal Deputy Commissioner of the US FDA, and as Commissioner of Health for Baltimore City.
Good evening, everybody. I told myself no matter what, I would be the most energetic presenter. And now I'm like doomed. I know that it's not going to happen. It's such an awesome presentation. There's no way I'm going to match that intensity. But I wanted to talk about the health perspective on vacancy. I do have a slide that'll come up at some point. But before we get there, two statistics. 70% of the time we spend at home. 70% of the time. And in US cities, 15% of the land is vacant, which is about the size of Switzerland. I thought that was an interesting statistic. Just a huge amount of space. So why is that relevant for health? And I'm going to make 2 points. One is it's relevant for the health of individuals, but even separate from that, it's relevant for the health of the community. And for individuals, there's actually quite a lot of evidence about vacancy and housing stress and the impact that it has on individuals. Violence is one of the most established linkages to vacancy. But in addition, mental health challenges, depression, heart disease. When I started as a clinician, I'm a pediatrician, we noticed, I was living in Boston, that housing was the greatest source of stress for our patients. And I took care of a little boy who was obese and couldn't walk at 2 years. And I asked his mom what was going on, and she said that he had to stay in his stroller because she was worried that they would get put out if the people they were staying with were bothered by him, and they were always threatening to kick them back out on the street, and so she just kept him in the stroller, and he couldn't even walk around. And that led to the first major project I ever really worked on as a doctor, which was about the importance of housing and health. And there are many different connections. There's actually a very interesting study that just walking past a vacant lot increases people's blood pressure. And so at an individual level, the housing you're in, the risk of what I just talked about, there's obviously lead poisoning in Baltimore, asthma, often linked to rodents, many different pathways. An entire lecture on all the different ways housing directly affects individuals. But what I think is the most interesting for this discussion is the effect that it has on neighborhoods and communities. And there's actually a whole literature in public health about that also, that vacancy is linked to reduced collective efficacy, less organization in a neighborhood, a loss of control. And those are the kinds of things that communities need to address those threats to individuals. So it sort of hits at both levels. It's harmful to the health of individuals. It undermines what a community can do to recover from that. And it reflects and reinforces disinvestment in communities, because if the area has a lot of vacancy, if there's a crime problem, it's very, very hard to figure out solutions to turn that around. I want just to show one slide. So I'm going to at least win on the fewer slides metric. For now, but I think Stephanie's going to beat me. So this is a study that was done in Philadelphia, where what they did was they spent a relatively small amount of money to green vacant areas of Philadelphia. And then they extensively studied what happened. And they studied with comparison areas. And they found that people who lived near the greened areas had a nearly 60% decline in the fear of going outside, a 76% increase in open spaces. And when they looked, they saw that there was less crime in these areas, but it wasn't 60% less. It wasn't 75% less. But it was substantially, it was like 10, 15% less. But people felt so much better about their neighborhood. And that would lead them to want to walk outside to a community meeting, get involved in specific projects, think about what it might take to get businesses in the area. And it is really that second level that I think people, at least in public health, have not appreciated as much as all the little individual connections to poor health. I think about various activities that have gone on in Baltimore, and one of the most striking that I was ever involved with was when I was the health commissioner. We had a person come to us, an epidemiologist, and said that it would be possible to calculate life expectancy by neighborhood. And Baltimore did the first neighborhood-based life expectancy set of reports. And as you may be familiar, those have been repeated by the health department over time and have found more than 20-year gap between neighborhoods in Baltimore. And we made it a point when I was at the health department to go to every possible community meeting that we could get to talk about them, what they meant, to try to encourage people to use the information to advocate for things, and they did in some cases. But what is striking is not just sometimes the challenge that neighborhoods have, but the difficulty that they have in accessing information, tools, and power to be able to change the horrible conditions that exist. And I think vacancy and addressing vacancy really does operate at these two levels. And the solutions we should evaluate not just on the individual level, but on the ability of neighborhoods to recover, rejuvenate, and gain self-control and control, organization, and power. Thank you.
Thank you. Our third speaker is Stephanie Smith, who is the Assistant Director for Equity in the Baltimore City Department of Planning and a member of the Maryland Bar. Stephanie is a graduate of Hampton University, University of Delaware, and Howard University School of Law. She has spent the bulk of her professional career working to advance environmental health and justice through federal clean air policy. Most recently, Stephanie served in the executive leadership of a professional association focused on higher education and public health. Stephanie is an active member of the Greater Baltimore Urban League and Greater Baltimore Leadership Association.
I'm so excited to be here, and I'm also a little bit delirious because I just got off an airplane from New Orleans. I was at the American Planning Association conference, and it's such a great bookend to my weekend, to be surrounded by young people who are really interested in moving their communities and cities forward. And I want to focus my remarks around a project, a citywide plan that we are currently in the process of finalizing, and it's called the Green Network Plan. And it's entirely focused on how we can take communities that are particularly plagued by vacant and blighted properties and transform vacant and blighted properties into green amenities that can really hit at a triple bottom line of helping people, making sure that they are feeling safer, and hit on all the health touchstones that the previous speakers mentioned, but also how can this land be better prepared for prosperity for the community, which is the second P. How could this perhaps invite further investment in communities that have experienced systemic disinvestment? And then lastly, the third P is planet, because we know that as we improve the green infrastructure, we can also build a more resilient city as we are dealing with the realities of climate change and other eco challenges. So I wanted to say that I did win the no slide Olympics, so I do not have an additional visual for you. But in my presentation at the APA conference was one of the slides that Eli had, which was the 1937 residential security map that you showed that was essentially the redlining map of Baltimore. So when we were thinking about combating the roughly 30,000 vacant and blighted properties in Baltimore, the overlay of their concentration is almost exactly where the redlining map reflects restricted access to mortgages and other types of investments from 1937. So I think that what's really important is that we as an agency realize that we are dealing in a reality that was not accidentally experienced. It was literally planned. And this is an opportunity to think about what suite of tools and what suite of approaches can be applied to unplan it. So I don't want to misrepresent the Green Network Plan as the smoking gun, the one singular effort that will transform blighted communities, but I think it's a step in the right direction. So let me kind of get back to the genesis of the Green Network Plan. How many people in this room are familiar with the housing market typology or various market value analysis that people use across the country? For those who are not familiar, I think the shortest way to explain it is that traditionally people are thinking at a municipal level about how they can build from strength, and that is generally market strength. And as you can imagine, if you're always kind of building your investments both from a capital framework or in partnership with the private sector from market strength, then the areas that have been facing disinvestment, they never seem to get their moment in the sun, right? So the Green Network Plan is specifically focused on communities that are plagued by blight and vacancy. So that itself is somewhat a departure from the well-accepted notion that you build from strength. But I think we can also expand the concept of strength beyond the market framework to the people that have endured very challenging circumstances in these communities. They are themselves a form of strength, not only for their community, but for our city, Baltimore specifically. So we've made sure that as we developed this plan, we developed it with community, not just on their behalf, because I think that is also central to some of the challenges these communities have faced over several decades, is being left out of the very conversations that are framing the future for their communities. So for a period of about 2 years, we engaged over 600 residents. There's a combination of people that are definitely invested from a professional standpoint. They may be part of nonprofits that are focused on environmental improvements, things of that nature. But it was also important to talk to someone who's truly living on a block that's filled with vacant properties about what they would want to see. And I think there were two things that were really important that were flagged. Even when people were excited about an opportunity to identify a blighted or vacant lot to be repurposed for a green amenity, be it a park, be it a playground, or something of that nature, they were very much concerned that this new green amenity not transform into another blighted property. So I think that was something that we definitely took to heart, is that the maintenance of the new transformed lot was very central to the concern of the community, because that is often something community members in Baltimore struggle with just on a day-to-day basis, making sure that they are combating dumping and all these other things that can make it very challenging for communities with limited resources. So we were very sensitive to that. And there were 4 focus areas that we began with, which were the areas that were most affected by this phenomenon. And we had a location in East Baltimore, Central, West, and Southwest Baltimore. Now, I'm going to ask you guys to do something. How many people in here have a smartphone? I imagine it's most of you. If you go into your online feature, if you type in BaltimoreGreenNetwork.com, you can look at all the slides I didn't give to you. And you can look at the executive summary of the Green Network Plan and also see the maps of the focus projects. But the more important reason why I'm mentioning that you visit this website is that public comment on this plan concludes April 30th. So there's still an opportunity for you to review the executive summary as well as the expanded plan, but also to give feedback. So getting back to the focus areas, one of the issues that we faced was there were sometimes planning already underway in communities, but perhaps they hadn't thought about the greening aspect of it. So we didn't want to necessarily take over a community's priorities, but we wanted to infuse our objective into something that they were already concerned about. So in Broadway East, there was a community-identified park, Gay Street Park, that was able to be repurposed and really settled. It was not a very inviting park before that. In Druid Heights, Upton, in the central area, there's a Baker View affordable housing complex that is going into a second phase, but there's also out of 72 properties nearby, about 63% of them are vacant. So there was an opportunity to build a playground in partnership with Kaboom, which I think many people in this room might be familiar with. So it was not only transforming underused lot into a playground, but it was also giving real purpose and real recreation opportunity to the families of the nearby recently developed affordable housing. So we were trying to figure out how we could be meeting needs, not just doing something that's pretty, something that's relevant. And then lastly, I don't know how much time I have left. I have 1 minute? Okay. Lastly, I think something that is really important to think about when we're thinking about just green amenities and how we can better connect people to them is that Baltimore has 6,000 acres of parks. It has 2.6 million trees. It has a lot of historic and beautiful major parks, but they're not always connected to the people who need these amenities and this exposure and access the most. So we're really looking at how can we connect people via trails, how can we kind of knit together the existing green infrastructure. It's not all about creating new, but giving access. Because as you showed in the previous slide about the overlay of disinvestment, these are also the areas that have the highest timeline for getting to a job in terms of transportation timeline. These are also the areas that have the lowest median income. So there's a lot of great things about the existing Baltimore experience that are not fully being experienced by people simply because they don't have access to it. So we're hoping that through this green network, we can link people to existing green amenities, create new ones, and then help communities leverage that for investments that they want so that they can be more on the offense and not always on the defense of unfortunate policies and approaches. So thank you for your time, and please visit BaltimoreGreenNetwork.com. Give your input. Thank you.
Thank you, Stephanie. So our next speaker is Klaus Philipson, who is the president of ArcPlan, an architecture and urban design firm in Baltimore, specializing in community revitalization, adaptive reuse, historic preservation, and transportation since 1992. He received his professional degree of architecture at the University of Stuttgart in Germany. He has also worked as an architect and planner in Stuttgart, Germany, and London, England. He has been named a fellow of the American Institute of Architects for using his profession to affect communities through advocacy. He is a recipient of the Baltimore Larry Reich Award, given to individuals whose volunteer and professional work exemplifies a special commitment to community-based planning and design. He's the author of Baltimore, Reinventing the Industrial Legacy City, published by Routledge.
Can you guys hear me without this need the microphone? So, the architects can't do the acoustics, right, huh? So, a lot of things have been said about health and vacants, and as an architect, I want to mooch a little bit of on what has been said before, especially Dr. Sharfstein's observation of these 20 years life expectancy between neighborhoods in Baltimore that are only a few miles apart. Is basically the difference between Rwanda and Switzerland right here in our city. And as an architect, one has to conclude that this kind of discrepancy, where we now colloquially say that the zip code determines your future more than your genes, must have some manifestation in the built environment. And in the built environment, the architects, planners, and landscape architects and engineers that live in this building here and train in this building, they are somewhat responsible for this. And so there are various levels in which this responsibility comes together. There is the building level. Dr. Sharfstein spoke about this: lead, asbestos, asthma, rats in the building causing asthma, and lack of daylight or too much heat, passive lifestyle if you build buildings that don't have obvious stairs to walk up and down, formaldehyde, glues, there is a whole lot of things that directly affect health that manifest themselves then particularly also in vacant buildings, but they're also in occupied buildings. Then there's this, architects, they like to justify, because they're not really scientists and they're not engineers, they like to justify their art with science or with real data. So for a long time, architects said, well, architecture is good business, good design is good business. So they tried to underpin this with dollars and cents. Then came this whole health discussion about, and then architects said, well, we gotta prove that we can really influence health with good design. And so in 2015, the AIA, the National AIA, created a health committee and made a big announcement about that they want to study that. And so knowing that I was invited here, I contacted the CEO of AIA and the current president, that I know both of them, and said, well, so this is now 3 years into this 8-year program. What can you send me that I can tell the audience, here is proof. There is a chart, and when you build it well and you design it well, then your health goes up by so much, right? Yeah, unfortunately, what I got back was not quite like that. So I got a lot of citations of research papers and so on that talked about all kinds of things, and most of it is still aspirational. So we all do know that we have a responsibility and that this built environment has something to do with our health, but we don't quite know exactly how when we are going beyond the level of these immediate factors like poisons in the building. So as has been already noted by Dr. Sharfstein as well, is that the neighborhood as a larger environment, and Stephanie said that too, that the neighborhood makes you feel better or worse, and the stress levels that you experience, they are often coming out of your neighborhood, because if the services don't work in your neighborhood, if the neighborhood is full of vacant buildings, if there are no street trees, if the street lights are out, if the sidewalks are broken up, then you are experiencing stress because you are really not happy in your place. And that gets to this whole thing about happy cities or happiness and health. And there's a lot of science on that people that are happier, they are also healthier. So the psychology of all of this, your brain on architecture, that is really where it's really getting interesting and where it's also much less scientific. So these approaches on these three levels, the building and the building type and the neighborhood, they have a lot of reflection in science as well. So, it started, of course, back with Mencken when he said, when he talked about the libido for the ugly. So I'm not going to read the whole quote. It's very anti-American in a way, and I can't really do that. But he was observing, that there is not enough attention paid to the physical appearance in a way that people feel comfortable and happy, and that too much attention is paid to just, the basic functions of things. So it falls then into these social, political, and then this subjective experience fields. So and in the social political, you can, of course, allocate a lot more facts and figures, and then you can talk about equity. And equity is really what it all comes down to, as Eli already emphasized in his presentation, that the equity is not there, that there is inequity in everything, in how the buildings look, how many are vacant, what the services are like, how many street trees there are, and how many street lights are out. That all varies, and in those Rwanda neighborhoods, it is that these levels and services are the worst. And so I'm working with Senator Nathan Pulliam on a task force that is now legislated that's called Social Determinants of Health. And I'm learning there what these very tangential relationships between the built environment and health can be. And so we talked, for example, and those were all the non-architects in the room. I'm the only architect in that group. Talked about lighting and lighting on the buildings. So lighting, when you have vacant buildings, then there's no lighting. And so how does that affect the well-being and how you feel about your neighborhood? So I guess my time is about up. So in conclusion, it is really on many levels on how we can engage to make our communities healthier. And it's not just about the vacants, but it is about the vacants, and that's one last plug for preservation and Baltimore heritage. The pride in a community also manifests itself in the buildings. And if we demolish them all, we lose our character. Thank you.
Thank you, Klaus. Our last speaker is Jennifer Gould, who is currently serving as the Executive Director of Neighborhood Design Center, which is called NDC. She has a bachelor's in interior design from Indiana University and a master's degree in historic preservation from Columbia University. She is an architectural historian and historic preservation professional with over 10 years of experience in Maryland's historic neighborhoods. She's passionate about equity in the places where NDC works and is especially focused on communities working on planning for safe and healthy public spaces, access to community-based development, and multimodal transportation. Jennifer has been involved in many of the city's most transformational historic building rehabilitations, including American Can Company, Brewers Hill, Tide Point, and Clipper Mill.
Thank you for welcoming me. I'm going to pull up my presentation so I can see what I'm doing. As he said, I'm Jennifer Gould. I'm here from the Neighborhood Design Center. NDC is a nonprofit organization that was founded in Baltimore in 1968. I'm going to share our mission with you because I think it's central to what I'm going to talk about tonight in terms of activism and the relationship between health and vacancy. NDC facilitates the development of healthy, equitable neighborhoods through community-engaged design and planning services by providing the tools, expertise, and partnerships necessary to realize neighborhood visions. We support broad participation in the evolution of the built environment. That mission, founded in '68, was brought forward by a group of activist architects out of the AIA. They'd gone to the '68 AIA conference, where there's a legendary speech by Whitney M. Young Jr., who basically said designers are equally responsible for the inner city conditions because we are a commissioned profession, and therefore we work for the people that have capital to change the physical environment. So the people that build the roads use designers to build them and get people out to the suburbs. The people that build the suburbs and provide mortgages only to the white families hired architects to do all of that work. And then the planners that worked in partnership to develop the system that provided mortgages to some and others not. All of that was done hand in hand with a designer. And so the mission out of that '68 movement was to provide design services to community members that wouldn't normally have the capital to hire those services, and to provide them directly to access capital. So that early work was, working with the neighborhoods as we do today, low and moderate income neighborhoods that were excluded from those structures, so that people could tackle the issues that they were living with and change their own landscapes. And so that community engaged design work is activism. Communities know what they need. Sometimes they can work in partnership with agencies and other professions to get what they need. Sometimes they need to stand up and create a fuss and advocate for it. And they can do that through lots of different ways within their physical environment, even if they don't currently have access to capital. So you'll see a lot of NDC's partnered work doing things that have, they might be about vacancy, but it ends up being something more like an event. Because if you can't buy the house and change it yourself, you need to draw attention to the way that somebody can buy the house and do something with it. So how does NDC work? Neighborhoods come to us. NDC doesn't initiate projects. Communities come to us and ask to partner on activism in their physical space. This image, which can't be seen on the video, is a community member and a group of other partners working together on West North Avenue to create a streetscape plan for the communities along West North Avenue. It's about a dozen communities that came together, asked NDC for services, and we partnered with them, as well as the city agencies that would be potential implementers for over 2 years to come up with a plan. Because that plan had so much community involvement, there was a lot of faith in its ability to be implemented, and state, city, and federal agencies partnered together to provide $27 million that is now North Avenue Rising off of the strength of this community-driven plan. And now we're getting the next level where Councilman Leon Pinkett says, this is 5 miles that hasn't had a cent of investment in 50 years. $27 million, it's a drop in the bucket. Time for everybody else to line up along this streetscape and do something about the vacant. So that is the way in which true community-driven design can transform people's point of view about readiness, point of view about people's vision for their place, and then demand activism all the way around it. So who do we work with? We work with communities looking to create change in their physical environment. When you don't have access to the actual buildings, often what the space that they can create activism in is the vacant land. So you'll see communities doing things like this at the Why Not lot, where you create a cultural experience, because that cultural experience shows the identity of place. It builds relationships between the people that are there for greater resilience, which also creates greater health. It makes spaces where people spend time outdoors with one another. Also, health building. People know how to build a healthy neighborhood. They just need access to the space and safety in that space in which to do it. Another way that communities show activism through design is through community-driven plans. So communities can come to NDC and say, we want to do a community-based plan. In many cases, planning will join in on that. Sometimes they won't. Communities can do it anyways, and then they're in a power position. When it comes time, DOT says, okay, we're gonna put in this new one-way road. They can say, wait a second, that's not what's in our community-based plan. That's not okay. We all got together and came up with an idea. Or we have a lot of vacant parking lots in one section of our neighborhood. That is not creating a healthy situation. We'd love to see mixed-use development there. We welcome it. Bring on the developers. Other strategies often center around vacant land as well, and those can be community farming and community gathering spaces. This is the Reservoir Hill neighborhood. Following the post-68 and then post first wave of drug epidemics in this neighborhood, what had been their retail sort of center part at the center of Reservoir Hill was vacant and abandoned, knocked down by the city. This whole area was just a rubble pile. Neighbors who were community gardening on the right decided that they wanted to further take over the big area on the left. Just started joining together as a neighborhood planting on it. Over time, negotiated with the city to receive long-term lease. And then the Reservoir Hill Improvement Council, which is the local CDC, also gained access to the space at the top, which they've now transformed into a community park where you can host barbecues or parties. The farm market sets up there. And so now the space has regathered its heart space to the degree that there's kind of debate about whether this should be permanent green space or whether they've just driven the market enough that actually it should and could go back to being a commercial heart for that community. And that's a robust and open dialogue because of how engaged everybody is there. And additionally, it's so now well recognized and beloved that in this past year where they're starting to discuss about putting a rail line underneath this space, there was a discussion of a plan to do a giant vent in case there was an explosion in that tunnel that would have come up and taken over this entire space. And that was immediately kibosh because there's so many people attached. Additionally, vacants can be a very direct space of activism. This is the side of a vacant house that was occupied by a group called Tubman House that does community engaged programming with the Gilmore House project right next door. And they occupied a house there and used it to hold supplies and took over the vacant lots adjacent for community farming. They do community programming with the kids, dance days, and as well as, doing re-entry programming for people coming back into Gilmore homes, and just every day, sharing out, bringing in food and sharing it back out, bringing in clothes, sharing it back out, and they create this really safe, friendly space at the corner right adjacent to where Freddie Gray was picked up. And now I'm hearing some buzz that Gilmore may actually be going into redevelopment. Whether that's for good or ill, I can't say yet, but it does bring attention to spaces like this. And then also, that vacant land can be a very productive space for both food and food deserts, as well as play spaces and play deserts. This is the Duncan Street Miracle Garden, which has been farmed by Mr. Schor for almost 30 years, providing free food to the neighborhood, as well as a really safe space for kids to spend time. And even we took down the fence for like 2 days in order to paint that mural, and you can see how much trash flows in even over a couple of days. Just having somebody there every day to care for it and pick up the trash is just in and of itself a benefit, to have people that are attached to these places and just doing that everyday maintenance that does improve health. And then finally, there are ways that communities are activating towards more direct interaction with the market itself. So right now, United Workers is working to set up a land trust structure in the city. They advocated and got legislation for a housing trust fund. The housing department has now stepped up to seed that with $2 million. And there's a proposal coming through city council to put a fee on some of the real estate transactions for income producing properties that should flow off up to $20 million per year that could be put into that trust fund. And the land trust structure really provides the opportunity for communities to get together and build cooperative housing structures that would then provide a low-cost entry that would then be building community equity rather than equity for a real estate developer or providing a permanent situation where they're in housing-owned properties that doesn't allow them to get that equity at all. So I'm very excited to see where that's going. Finally, I'm going to give a couple plugs for ways that you can get involved with NDC. We're hosting a conference June 8th and 9th in the Station North community where we'll be talking about a lot more about topics like this. Attendance is quite affordable. If you're a student, there are volunteer opportunities so that you can come for free. We're also hosting D-Center conversations at the Motor House. The next one is on tactical urbanism, and we hope to get out and get our hands dirty afterwards, so I hope you can join us.
Thanks so much for your wonderful presentations. This is what we are going to do now. We are going to have 1 hour for the roundtable, and I'm going to ask some questions, and then each speaker, each panelist is going to have about 1 minute to address that question, and hopefully others can get in and discuss. So my first question is for Eli, and that's about the history of vacancy. Yes, you can use that mic. That's about the history of vacancy. Why does it matter to know and understand the history of vacancy in Baltimore, and how is Baltimore different from other cities, or the features of vacancy blight are the same in different parts of the world?
I think Baltimore actually has a great deal in common with other cities with very serious levels of racial inequality. St. Louis, Philadelphia, Cleveland, Chicago, Oakland, all come to the fore as examples. But you can see it equally replicated in small towns in Cumberland, in Cambridge. It's certainly because of a city of our size, which was old and large, it is a big problem here, and in part also because we have been innovators in the field of legal and financial ways of creating and enforcing inequity, whether that's from the sort of some of the earliest uses of racial covenants under the Roland Park Company, going back to the sort of being thought up in the 1890s to the infamous 1910 segregation law. So Baltimore is not unique. I think that what's key to understand about the role of history in this discussion is around the question of accountability, and perhaps more broadly, how do we think about applying restorative practices or sort of restorative justice to the kind of violence that has been caused by these practices historically, and really where the sort of folks who advance a restorative justice framework suggest people start when they try to work out how to make something right, is they start with the question of what happened here, who's been harmed, and how have they been harmed. And I think that we need to forefront that discussion, which is inevitably a historical discussion, because it's things that have happened in the past.
So at the School of Public Health, we recently hosted the Detroit Health Commissioner, Dr. Jonae Khaldoun, and she came to talk about Detroit, and she started 100 years ago. She started with the redlining map of Detroit. She talked about the decline in the population. She used to be the medical director of the Baltimore City Health Department. She drew many parallels between Detroit's experience and Baltimore's, and actually one of the very active issues is how best to do vacancy issues in Detroit, where they have more vacants I think by a mile than Baltimore. And they have, for a while, they were actively tearing things down. Then people became concerned about the health consequences of tearing things down too quickly, and it's been a big issue for her. We opened it up for discussion, and the most interesting question that she got, I thought, from one of the students was, you talk so much about the role of racism, segregation, and policy in creating the challenges that Detroit faces, and up to and including the bankruptcy when the health department went down to 5 employees. So she told everybody what those, it was just unbelievable, the problems that they had. And so what are the roles of undoing those things and the solutions to the health problems of Detroit? And that was a very interesting discussion, and she talked a lot about work that she does outside the traditional lane of public health.
Just coming back from the APA conference, I think it was interesting to see how many cities were rooting for Baltimore, but also cities that were looking to Baltimore for even direction around vacancy. I think sometimes the default is to think that perhaps we're only in a deficit framework, but there are also people who are trying to figure out how they can more safely demolish and deconstruct properties as well. And, you know, interestingly enough, some of the things we're doing were even, you know, safer than what other communities were doing. So that was kind of astonishing to me, is that there's so much work that needs to be done across this country that people are grappling with. And I think we haven't even scraped the surface of really thinking really thoughtfully about it. But I think one thing I just want to reemphasize from my prior remarks is that the solutions are going to be in the community, much to what you know, you presented in your last presentation. So I think that, yes, a lot of this was derived from municipal decisions that were intentional, but I think the solutions are not just going to happen in government, and they're going to also happen with communities truly being listened to and participating in their own fate with the support of government.
And there is another element driving the vacants, which is the matter of supply and demand. And so, me coming from Germany and then had a short stint in London, I had, before I went to London, never seen any vacant buildings in the city, other than, you know, once in a time that stood vacant for a while, but not like forever, and never whole blocks. So the city in Europe usually is still a place where people congregate, and outside the city is where you can't easily build or not build. So the land use laws play a lot into this, and as Eli pointed out, our transportation policies. So the combination of land use laws that put an oversupply by basically every farmer can develop their farm if they so feel inclined and without much oversight, and transportation policies that kind of build all the roads out to those farms, and racism, that is like the trio that made the American city empty out, and that needs to be reined in. And it's kind of interesting, this developer Lineberger likes to say that in the suburb, if you add more of the same, you make it worse. Because if everybody goes out to have a green yard and nature, and everybody does this, then you lose the thing you came for. Whereas in the city, if you add more of the same, it gets better. The more faces in the street, the better. The more density, the better. There are more different uses, the better. We have now come to a point in the history of depleting the cities where the capital itself and the mechanism of our supply and demand economy has realized, hey, this is much better to be in the city. So we are now not producing with smokestacks and all that stuff anymore, so the city has become an attractive place again. And so now we are seeing a sort of almost a reversal of racism, because the people that were left and stuck in the city and had no chance to move out, they are now getting displaced, and then it's called move to opportunity, and they get relocated somewhere in the suburbs. So I just wanted to put this in because I know there are some land use planners and planners in the area here in the room, and that's what some of you train for. And zoning and the supply side is a key piece to vacancy.
But Klaus, are there any similar cases in other countries? And I mean, is there something out there that we can learn from?
Well, sure, we hopefully all learn something. There was just this week a conference in Annapolis held by the Maryland Institute for Smart Growth, or the National Institute for Smart Growth. And it was smart growth after 20 years, and Hogan spoke and said, well, the governor, I am for smart growth. I'm focused on smart growth. And then, you know, at the same time, he wants to build $6 billion worth of additional roadways on the Beltway. So we didn't quite get to the point how this jives, but there are certainly a lot of states in the country that have done successful smart growth. Like Portland is always the model case for this. And by just restricting how much stuff you can put outside in the areas where it's actually not sustainable to build all that much, their core city revitalized a whole lot. And there are examples inside the country as well as outside. But I think as long as we are not restricting what you can do on agricultural lands and forest lands and so on, we are not going to see a full revival of all our towns and villages.
Thank you. So my next question is for Dr. Sharfstein. And recently, you mentioned the study that you had on life expectancy in neighborhoods, and apparently there are many new studies that are providing big data on these neighborhoods. How do you think this big data is going to help us as architects and planners to come up with strategies that probably we did not deal with before?
Thank you. First of all, if he's Klaus and she's Stephanie, I'm definitely Josh.
Sure.
Second of all, big data is a big it depends in my mind. I think that there are definitely some people who are very excited about the opportunities in the healthcare area for data to provide new types of insights. There are other people who are kind of skeptical about it and think that you still need to know what you're doing with data. Answers don't pop up. You can wind up chasing all kinds of strange findings if you don't really bring a well thought out framework to whatever you're looking at. I think that the biggest barrier is this political barrier to try to figure out how to get resources into areas that traditionally haven't had resources, and then there's a policy barrier of how to do strategic investments with as much impact as possible. And I think it's the kinds of things that we've heard today that are very hopeful. I wouldn't take money that would go towards improving a vacant lot and put it towards a computer somewhere.
Thank you. And Josh, one more question. Is there any relationship between urban vacancy and access to healthcare facilities? And do you think that there must be a relation between them? Are you aware of any studies on this?
Well, there's certainly a relationship between urban conditions and access to food. There's a lot of data on access to food, and there's a lot of data on the very difficult time people have accessing fresh food in the food environments that are available in different parts of Baltimore and other cities. Healthcare access, the gap in healthcare access is primary care in Baltimore. It's not whether you have to go 12 blocks or 6 blocks to get to the emergency department. We have so many hospitals in Baltimore. It's not that it's not the distribution of hospitals. It's people can get to a hospital very quickly from all parts. It's really whether they can get the kind of care to keep them out of the hospital. And there are parts of the city, particularly, that really have been starved of basic health services. I'll tell you, without too many distinguishing characteristics, there was a major healthcare organization that came to me and asked whether if they shut down some parts of their hospital beds and put that towards community health services, would I, as health commissioner, be supportive of that? And closing hospital beds makes people anxious because they're worried about the job loss from hospitals, and jobs are very important, and of course there'd be different kinds of jobs if you did neighborhood health services. But I'll tell you, from a health perspective, taking money and really investing in community health services, community health workers, primary care offices, behavioral health services, addiction treatment, mental health care, that really prevents a lot of problems. One of the things that we did when I was at the state was set up a project called Health Enterprise Zones, which was really aiming to try to get community-level health investments. So I think it's just important to be clear what kind of health services. And there are definitely parts of the city that are in desperate need of more primary health services.
Thank you. So, Jennifer, as I read in your biography, in the last 10 years, you have been mainly involved in nonprofit organizations. You have, you have done a lot of volunteer work. So how do you think the role of NGOs could transform? I mean, because you guys are already working with the city, okay, so you guys are already working with the city and other organizations, but what is missing? What could change to increase the efficiency and make it more productive?
Right. So, you know, the Neighborhood Design Center really allows for that radical wisdom of the outsider to come to the fore through the recommendations. They're talking about things that they directly know they want and need. But often then the processes to move that forward through the bureaucracy and the differences in communications and the pipeline for building large projects doesn't match up to those community visions and goals. So if you're working at the vacant lot scale, the average budget might be somewhere around like $200,000. And so the big agency budgets have trouble accommodating that scale of budget, and or the small grant world doesn't quite give enough. So there's kind of this gap into how community members can move projects actually into implementation, as well as kind of how those community level visions that might be very much about the way they want to use the space rather than the way the space is going to look in the end, a lot less driven by aesthetics and more about function, get shot back out the end of a municipal level project. So that funding pipeline, the communications pipeline, there's just, I think, a little bit of a mismatch. So things either go from idea up to MTA. MTA says, okay, what we can fund is 5 miles of bus lanes, and then it cuts back out that that's what they're gonna do, and everybody's like, where's our trees? And then you have to micromanage getting all the trees in and talk to BDC and hope you can get storefront facade grants. It just becomes this cobbled up mixture of agencies and programs, and the neighborhood starts going, oh my God, we can't manage that. Who's gonna help us understand the pipeline for all these different programs and how we can leverage it all together? So there's that kind of project management across the big idea.
Sure. And going back to what Josh said, have you guys ever worked with any health agencies?
For example, like the North Avenue Rising, some of our transportation projects pull in health department to do that sort of health quantification on the changes that are recommended. That's the main space in which those things end up integrating, but the communities are certainly well aware of how that data gets built into, say, the Baltimore Neighborhood Indicators Alliance data, and pull on that often for the reasons why they're pushing for things.
Sure. Klaus, you wanted to?
The topic of NGO kind of is a big topic, or it's a different topic, and I'm not talking about NDC, I'm just talking about NGOs in general. So in the last 20 years in the United States, I think we have like 40% more NGOs, if it's not 60. I'm just writing an article about it and trying to remember. It's an incredible increase. So when the government doesn't do their job anymore, and we, our citizens, are not paying our taxes anymore for the government to do their job, then we are relying on NGOs to cover all this. But what we all need to consider is that the NGOs are not really accountable to us. We are electing our representation in the city council, and we elect our mayor, and we elect these people, and we can vote them out of office. We cannot vote the NGOs out of office. And I think it has gone way too far with pushing all the responsibilities on the NGOs to fix things that the government should do in the first place. And then the latest incarnation of this is that, you know, the mayor is starting to look at private sector. So now we are doing housing with the private sector, public housing with the private sector. That's getting even worse because they are even less accountable. And so, I mean, I just think we need to really rein these things back, and health and housing and these fundamental things that we need to live and have a roof over our head and education, those things should stay under public control. And this goes outside a bit of your initial question, but I think it is worth considering because we are so, and that is a very US thing to do, to rely on these other sources.
One of the things that we're working on in planning is developing a resident planning academy. I know there's something similar in Philadelphia where community members are really getting not only increased capacity around how to navigate what can be an intimidating and complex land use system, but they're also expanding their own personal network. And I think, in 2013, the planning department did partner with CPHA to do East Baltimore Leadership Academy that was very, geographically defined to help communities that were really feeling kind of beleaguered by the developments around EBDI and Hopkins and not knowing how to react or how to plug into that. And people from other parts of the city wanted to participate, but it was pursuant to the grant geographically defined. So that's why I think it's really important that we're having this conversation, because even the fact that a community would know to contact you already shows a heightened capacity. There's a lot of communities who still don't know about the resource that Neighborhood Design Center presents. So we're hoping that, we're always hearing about how communities lack capacity, but I would offer that, quite frankly, the government, major stakeholders, and the larger philanthropic community lacks a lot of capacity around cultural competency and also around engagement in a meaningful way. So I think that if there's at least some openness to everyone kind of being honest about what they really know how to do well and what they need to be working on improving so that they can be better at their jobs. I think that communities would really benefit in the long run. And why the Planning Academy, I think, is different from some of the other things that are happening in Baltimore is that many things are episodic, they're one day, they're really great, but they're not really building skills in an ongoing cohort model. And ultimately, I think peers learn best from each other, and quite often, folks really know people in their community because we are a community of neighborhoods, but they could really benefit from hearing how someone else in their shoes is navigating a similar problem, but maybe in South Baltimore or West Baltimore, or somewhere where they do not live. So I stay tuned. I think we're close to getting some funding for that, but the one group that's not on this panel that I think is kind of the elephant in the room is the philanthropic community. I know they're undergoing their own kind of equity conversations around how they could be more effective, but there are a lot of communities that are getting seed funding from these organizations that are also being leveraged to get capital investment from the city, state, and other sources. So even if it seems small, it's often spawning other investments, and communities that need it the most don't necessarily have those relationships to get that support.
Yeah, I mean, I would definitely say, in response to what Klaus said, I would be so happy for everybody to be getting what they needed from the agencies and for us to shut our doors. I mean, we do exist because people feel like they're not being listened to, and it's also a limited funding environment. So the other thing NDC provides is that show of readiness, so that you can then say to DOT, we're ready for the next complete streets. We're the ones you should give it to, because it's not going to go everywhere at once. So it's a way to say, it'll be easy if you come do it with us. See, we did all the work already. Just do the project instead of having to go through all the work together. But again, we would be more than pleased for the government to give everybody what they want and need and to shut our doors.
The one thing, just to chime in briefly, because I think there's a hopeful potential in things like the sort of resident planning academy, where we have this vision of empowerment and providing people with the knowledge and skills and relationships that they need to make change in their communities, but it runs into this intention with the idea of devolution of responsibility for these problems down to the level of individuals, community organizations, and associated nonprofits. And we have, as a society, have, I think, a lot of grave concerns about whether that is compatible with democracy democratic governance, whether it's compatible with equity. And the broader sort of political context for this, I think we are sometimes hesitant to name names and point out the sort of things that are staring us in the face, such as, for example, the growth of the Baltimore City Police Department budget since the 1980s and the comparative dramatic decline in budgets for recreation and parks, the health department, other things that a growing body of scientific and medical research suggest are more likely to increase public safety on a dollar-for-dollar basis than the kinds of investments that we're making in patrol cars, in police overtime, in guns, in incarceration, in keeping people in jail, in cages. I think we just got to be a little frank about sort of where we are putting our money instead of into code enforcement, instead of into resident education, greening vacant lots.
I would push back just a little bit because communities want to be listened to because there's things they want in their community. And I think one of the other things that's being kind of omitted from our conversation that's central to health and to feeling good is having a job. And what are the workforce development opportunities or the entrepreneurial, community ownership opportunities that could come from this? I know there's a yet to be released study out of the University of Michigan that looked at how repurposing vacant and blighted properties. They looked at Flint, Michigan, they looked in Philly in particular neighborhoods, and one place that was literally like, there was a corner store where people pretty much get robbed and shot. And I think that's what they kind of dubbed it as, like the rob and shot, but that really wasn't the name of it. But after they repurposed a blighted property nearby, they made it a park, it was also inviting now this whole new experience. People were doing kind of the predictable things like playing soccer or doing sports, but now people were like grilling stuff and selling it to people, or a food truck would come up. It became a busy, fun place to be. And I think that there's so many opportunities for the same young people that are, trying to squeegee your car, or the same young people that are selling beverages on the side of the road, if they could be integrated into a landscape where if I wanted a drink, I could be supporting a young person's entrepreneurial efforts, or if I wanted, something else. I think the workforce development part is not just the maintenance of the lot, which a lot of people think about in terms of kind of entry-level work around lawn maintenance and things of that nature, and tree pruning. But I think there's other things that we're not even thinking about that could spawn economic activity in community, particularly for people that have limited transportation opportunities. They could be making money in their own communities. And I think that's something that we've yet to explore fully. And to be fully frank, that's not my professional wheelhouse of expertise, but I know it's a conversation that's worth having around vitality and health in a community.
Just 2 points, having seen it as a government official and also from different perspectives. I would say that there's no way that government alone can solve some of these challenges. And in public health, we think that it is true community engagement that really can get remarkable progress made, whether it's even increasing the vaccination rate or developing programs for young children. That it is part of what we teach in public health is the process of engagement, and there's no way that the health department could deliver good health to a community without the community really mobilizing. And like I said before, the health of a community is reflected in part in its ability to express what it wants and to be able to engage on that side. Having said that, I understand that in some circumstances you can get really difficult situations with certain nonprofits, but I think that is probably, in my experience, more the exception than the rule. And what I would also say, though, is that it can't be viewed as devolution. It can't be that the public agency is no longer responsible. It has to be that the public agency feels the responsibility, and through that responsibility is trying to identify ways to empower and work with many different types of community organizations. One of the projects that we're engaged with at the school is to try to bring that sensibility more into the school and to bring public health tools further out into all kinds of different community organizations. And we have a training program, which is a full scholarship for Masters in Public Health, either full-time or part-time, for people who are working in local organizations, public or private, nonprofit. And the idea is that if people are working in architecture, planning, community development, engagement, and they really become interested in this overlap with health, that is one of our focus areas, and they should apply and have brochures. And we'd love to work not only with individuals, but where it can be done full-time or part-time, but also with their organizations. And we hope to be able to develop cross-public health environmental planning projects in Baltimore and beyond.
Thank you, Josh. And we are going to have a few of the flyers for distribution, right?
I have so many flyers.
Okay. Thank you. My next question is for Eli, and now I'm wearing a different hat, my architectural historian hat. Many people, some people actually see the issue of heritage as preventing change, right? How can it become part of the solution, or like something that is encouraging people to get more engaged in their community, creates a sense of identity?
I think, like a lot of the public policies that we've talked about today, the public policies that structure the historic preservation as a profession and a field are sometimes poorly matched to the challenges that we face. And so, just as a for instance, a lot of times the preservation review process is applied in a way that's not very sensitive to the market conditions and the costs that, for example, putting on a real slate roof versus a synthetic slate roof might how that might affect the bottom line for a much needed reinvestment project. And so I think that's the kind of example that often comes to mind. I guess what I would like to see is that I think preservation is in part motivated by an understanding of the cultural and civic meaning that is associated with public spaces and the buildings that sort of like, you know, constitute our public space, the views of those buildings, the experiences of those buildings, and that further the preservationists for a long time have been sort of beating this drum of stewardship, of like that we take care of the things that we've got, that we should use what we have rather than always building new. And I think that there's I'll sort of do a quick plug for, I have been promoting a social media effort called 30 Days of Picking Up Litter, where I'm sort of inviting anyone else who's interested in joining me in picking up litter every single day for the month of April and taking a photo. We're most of the way done, but I've been telling folks all along, if you just pick up litter one day this month, you're still, you know, doing some yeoman's work. So I think things even as simple as that we should reconsider the way in which we are all preservationists if we're sort of exercising good stewardship over historic buildings and neighborhoods in a wide variety of ways.
Thank you, Klaus.
Yeah, that question of heritage and preservation preventing change is a total misunderstanding, which is common. The architect Rem Koolhaas said that there is so much preservation now that cities can't develop anymore, but that is wrong, because there isn't that much preservation to begin with, and it's a complete misunderstanding what preservation can do. You can have all kinds of change. The coolest things in Baltimore are the ones that are repurposed preservation buildings. Think of Clipper Mill. Think of the buildings on the waterfront at Henderson Wharf, Tindeco. Think of all kinds of wonderful places that are repurposed industrial buildings that are now serving an entirely different. So change is possible, and when you think about how cities develop from being places of production mostly, and industrial centers to places of idea exchange and experience, then how do cities compete with each other is what is commonly called authenticity. And where does authenticity come from, if not from preservation? And the National Park Service tried to underpin this argument with data and did a very detailed research study of 6 cities in the United States, and Baltimore was one of them. It turned out that Baltimore does have actually the highest number of preserved structures in the country, even higher than Boston. But that when you analyzed the economic well-being and the property value correlation with preservation, then those communities, and we all know this, you know, Fells Point and Federal Hill, that were preserved because the highways were defeated, those communities are thriving today. So the fine-grained historic heritage that we have in our buildings is a key element for economic development. And so that is the reality of it, and therefore we should be very careful also with Hogan's, second time. I love Hogan. I really love the governor. But when this core money comes to Baltimore, which is good, state money comes to Baltimore is always good, but the emphasis on just getting rid of all the vacants through demolition is wrong-headed. What Baltimore needs is 100,000 additional residents. And then we can fill every single one of those row houses, because the households today are so much smaller. We don't need all the 350,000 residents back that we lost. We need only so many households back. And then we can fill all the row houses. And that is what Boston has done. That is what Philadelphia is in the process. Well, they would be glad if they had done it already. They're trying. But Washington, D.C. has come a long way. So these cities, row house cities as well, they show that that's possible. It's not insurmountable. A few we probably have to demolish, but we need a long-term perspective. We can't have just a gazillion community gardens.
Thank you. It's really difficult to keep politics outside any discussion these days. If you don't mind, I have more questions, but I think we can have 15 minutes for Q&A if the audience have any questions. Unfortunately, the court is not long enough. But let me try. Yeah.
I can talk loud, I think. I was curious about how Baltimore, we started to talk about row house city. That's one of the things that always struck me about here versus some other towns when I travel, is the way everything's attached. And I remember working so hard one time on a vacant housing project where we were getting money from the state. And it was this wonderful butter brick, it was called butter mortar, but it was a iron spot brick bowed. You wouldn't ever be able to build like that again. And we just had about finished renovating it, and then they ripped down the one in the middle of the block right next door. And I was feeling just so struck by who would ever, put all money in this place if you're going to just tear down the one next door, because you pretty much have just scrapped the whole block. Because it's not like this community would have someone make something really innovative in the middle. Nobody is ever going to build anything in that middle. And so it was just like, oh my God, who is making the decisions here? So it was almost as if the city didn't even think about what's unique about what we have here and how do we go about doing this in a deliberate way. So I guess part of my concern was, has the city finally gotten to a place where they go, we want to retain this, we have to have rights for the community to get at the landlords that are sitting on the property or whatever. It seems like there was this disconnect. Communities couldn't even fight what was going on.
Was this in the context of Project Core, or was this long ago?
This was scattered sites renovation that CDC used to do. Okay. So this is 20 years ago.
Okay, I just wanted to make sure I was getting the...
So it's been a while,
okay.
But I just remember at the time it was so...
It's astonishing.
Yeah.
Well, I wanted to mention, at least with Core, my perception is that the governor just wanted lots of things to come down. But thankfully, I can't speak for him, but that's kind of the perception I had. I know we have comprehensive planners that divide up districts within, the city, and they work more closely with communities. So for example, there may have been a recommendation from the state to knock down a block, and community members working with our planners were able to lift up, okay, that block over there is highly problematic. The conditions of the home are quite severe. It may make more sense to do that. But we really think we could do something with this block over here. And you have to have those types of conversations with community to really, at a granular level, get a better sense of what the community feels like they can put their own efforts in to save or transform, or what they think might be best suited for total demolition. And I think those are the types of things that planners are able to do, even though we're not the implementer, is lift up kind of that prioritization that the folks who are sometimes doing the implementation don't always have the time or the perspective to do, to be honest. But I just wanted to back up about just, my husband and I just renovated an older row home that had been vacant for, 30 years or so. So we were the second to the last vacant house on that block, so now there are no vacants. But I think that when we're even thinking about preservation, if we want to be candid, particularly Eli talking about inequity, it has often been the stewardship of white memory, and what's been historically valuable to even the majority of residents here sometimes hasn't been preserved for many reasons. So I think we need to also have a real conversation about how we can enhance awareness around communities who may be living in a historic district and they don't know. That's something we're talking about within planning. How can we make sure that community members even know that they have this other leverage point or resource in the fact that they are a historic district? But also we need to be just more honest about our communities. I mean, I am not a native of Baltimore, but I do have family that's been moving here since the 30s. And there are a lot of people from Baltimore that don't know that Cross Keys was a historically black community, or they've never heard of Hose Heights. So sometimes we're seeing things today so disconnected from its past, but it's particularly the black Baltimore heritage that I think, if we want to be just really focused, that has often been lost in the conversation around historic preservation in this city.
I have a friend who's been developing really livable homes on the west side near, with a bunch of different small investors, where they would buy a house either that was in partial decay, maybe just the front, other ones a little bit better. And they've taken multiple blocks around Monroe Street and around the Bon Secours Hospital. Their problem has not been that there aren't residents that are homesteading in those homes that don't want bad things to happen on their street, because they do live there. It is their one investment. They have jobs, they're doing things. But the problem she's discovered is those folks that might be an employee at Bon Secours or employee at University of Maryland, or somebody that might be in maybe getting their master's degree from some of the schools right around there, all are interested. It's less than $100,000 complete home with new washer, new dryer, new HVAC, the whole business. The problem she has is banks giving these people the first home chance. And at Hopkins, there were opportunities where Hopkins gave, where I worked also, a little bit of help if you were an employee of Hopkins and went into certain neighborhoods. But it was very restricted to the neighborhoods, like you say, it's an NGO. It's about what they want, but still doing pretty good stuff. So I guess my question on her behalf, because I tried to get her to come, but she couldn't make it tonight, was what can the city do and or the health department do to maybe join with the communities and say, well, we're looking at less than $100,000 homes, truly stable environment, not something that's in a total disarray, but what do we do to get the banks in the game?
Yeah, I mean, I would say that credit is the new redlining. They've made it so that your redline status can travel with you anywhere, and it's not a matter of whether you're sitting in East or West Baltimore. Now they pump you into a system, offer you credit. You don't have the resources to pay or even understand what it means if you don't pay. Then you get a negative credit rating, and that travels with you everywhere you go.
I wanted to mention that I'm in a fellowship right now that is sponsored by the Lincoln Institute and the Center for Community Investment. It's called the Fulcrum Fellowship. It's an inaugural fellowship where we're thinking about these very things. And one of my co-fellows works for the Atlanta Federal Reserve Bank, and he was telling me that he feels like sometimes cities do not utilize the convening powers of the Fed banks in their regions, because he's like, we really can't make people do things, but people will come if we say come to something. come to a meeting because, you know, they're important. So I think that is something that could be explored, because you have to have a real conversation with these folks, because, I mean, the objectives of the Fed are, which is full employment, are best, you know, I think achieved when people have stable housing and, you know, communities from which they're living. So that's something that, at least in my own little role within planning, is something that I hope to kind of see how I can filter that up to the powers that be, because I've heard that from multiple people, the types of things you've described. And I've also heard that there are people that have great incomes, but they don't have the credit, like she mentioned, or they might have, you know, workable credit and a good income, but they're so intimidated by the process that they don't think they qualify. Like they're undervaluing maybe their own ability to actually secure the mortgage, so they're continuing to rent and, you know.
You put your finger on a real big problem, and one can blame the banks or not. It's always convenient to blame them, but they just screwed up royally by giving way too many mortgages out and then couldn't collect on them, and we all paid the bill for that. So that they are now more stringent is not necessarily a bad thing, I would say, from a fiscal perspective, but we do have this problem. And so therefore pooling money is a solution for Baltimore that we absolutely need. And there's one very good example, which is Berkeley, where the Community Reinvestment Fund was created, and they used private investors, and they pooled a whole bunch. I think they had like 200 or so private investors, and said, we share the risk with you, so you don't have the risk individually. And they got a good pool of money with which they got to the point where they had enough scale in changing Berkeley around that now they have fixed up with that pool of investment fund enough that a rehabilitation now done by an individual or by a small developer pays its own costs. So you can sell the product that you rehabilitated for the money that you put in plus a little bit of profit. But in many communities, we are not at that point. And so we have this problem of gaps and lack of money, and the mayor's idea of having a community land trust is another way of pooling money. So I think these two, private reinvestment funds and the community land trust on the government level, are both absolutely needed in order to get us through this problem that you described.
I think it's really critical that when we talk about vacant housing and health, and when we just talk about vacant housing in general, that we do include the financial aspects of it just as much as the physical and spatial. I'll point to a very, very recent study out of Detroit that was looking at sort of basically a cost-benefit analysis, or time to recover the financial investment in demolition money, with the idea that demolition does have a positive effect on land values that sort of spreads out within a certain immediate area. This is a theory that has pretty good evidence to support it. But whether is that boost enough for local or state tax revenue over time to recover the costs expended for demolition? There are other reasons that demolition might be a necessity, but simply from that fiscal analysis, in the example of Detroit, where it should be granted demolition is likely more expensive in that scenario than it is in Baltimore City, but in their most optimistic scenarios, they're looking at least 50 years in order to pay off the demolition costs associated with any individual property under these sort of statistical models. And I think that we don't want to confront that we are spending money in a way that doesn't respond to evidence, and that is excessively optimistic about our ability to recover them. And the worst offenders of this are not in Baltimore City. They're the folks who are building infrastructure in Baltimore County, Howard County, with very wishful thinking about what could possibly recover the sunk costs in those kinds of things, and no consciousness for the sunk costs that already exist within infrastructure and facilities in Baltimore City, public money, that we really need to be using these facilities, or else we're just, penny wise, pound foolish.
I was just going to say, you can look at a city like Houston to realize that the outer bounds of how foolish people will be with development, may not, we're out still exploring the outer bounds of that. And what happened with the hurricane there was so directly attributable to some of the sprawl that they had. And it's, but even that it's very hard for them to rethink what they're doing. Hopefully, one of the, maybe hopefully is the wrong word, but I think there are a number of forces that hopefully will rein in misunderstood development like that.
Thank you so much. And I think that at least one thing that we can learn from this panel is how important it is to get out of our silos and have a dialogue with people from different disciplines, especially considering how complex this issue of urban vacancy is. Thank you so much for joining us for this panel, and special thanks to our wonderful 5 panelists, Jennifer, Eli, Stephanie, Josh, and Klaus. Thanks so much again.